Hi there, thank you for calling Well Health Diagnostic Center. My name is Paul. How can I help you?
Hi, I would like to book an appointment for an imaging.
Yes, I'll be more than happy to help you with that. But do you have your requisition handy
I
with
do
you from
have.
the doctor? Okay. And is your requisition form marked as urgent stat or is it a regular requisition, any urgency?
Um, no, it's not urgent.
And what kind of ultrasound appointment you want me to book?
It's an X-ray, an ultrasound.
Okay, sir, for an X-ray, we won't be able to book this appointment because it's a direct walk-in, okay?
Yeah, but I have an ultrasound requisition also.
Okay. And what kind of ultrasound test you want me to book?
Uh, it's the calf. It's a venous lower extremity.
Venous lower extremity, okay?
On the
Is it
calf.
the okay, extremity, right?
Yeah.
Is it a DVT or a reflex?
Um,
Is it a DVT or is there insufficiency?
it's a DVT.
DVT,
Yeah.
okay. Is it for the right leg, left leg, or
Right
both
leg.
the legs? Okay, and sir, when did you get the requisition from your doctor?
Yes, a few days ago.
A few days ago. Like few days in the sense,
That
how many?
I visit my doctor a few days ago to get this requisition.
Few days in the sense, like was it on Monday, Tuesday,
It
Wednesday?
was, I got the requisition on Monday.
Monday, okay, fine. And any notes written by the doctor, clinical notes, medical notes,
It's
reason for
a
doctor, okay.
posterior calf, mass times 5 years, swelling on exam, RO mass, DVT, bony pathology.
Okay. And which clinic you want me to book this appointment?
Is it possible the King one, King Street?
Yes.
In
And do you prefer?
okay, 11 King Street West.
Yes, I can book that. And do you prefer any technician, male or female?
I don't mind.
Okay. So one last question. Our beds have a weight limit of 350 pounds to maintain safety and function. Can you verify whether you weigh above or below 350
I
pounds?
am 150.
Any mobility issues you have?
No.
Okay, fine. So, as I just want to let you know that as this is a DVT test, as you got the requisition on Monday, this is a time-sensitive test and should be booked after, like within 48 hours. So just give me a minute or two.
Sure.
Let me see what I...
Dr. Jane. How are you?
Pleased to meet you.
I wasn't the one that ordered this test. Dr. Lantis did. Um, it was for this lump that they felt in your right calf.
Yes.
Right? So the ultrasound looks like there's a little fluid collection. It might have been a bruise, but my understanding was this has been going on for a while, right?
Well, I could say almost 4 years.
Almost 4 years. Yeah, has it gotten a lot bigger?
No. I have been rolling with the ball, but
So it's definitely not, it's not like a muscle knot. It doesn't look, it looks very abnormal on the ultrasound. It looks like that there's a muscle tear, and they said it looks like there's a fluid collection, which usually happens with, let's say, you tear the muscle when a little bit of blood goes out, right? But I wouldn't expect that to persist for 4 or 5 years. Now, on the X-ray they did, it did look like there was a little kind of lump in your bone as well. So they didn't know what it was, and that's why I think they'd have to call you, because I think we need to be a little bit more testing to see what's going on. Did you ever injure
I have a long
that
history
leg?
of injury.
Okay.
Long.
How's
Like
that?
it has been injuring over and over and over again.
That area, that specific calf.
Yes. And I have problem with Achilles tendonitis, the soleus gastro, tight always.
Correct.
So it has a bad history.
Okay. Yeah, I think. Have you ever done a CAT scan of that area?
No, no. The reason why I was so pushy about having all this imaging is because
Uh-huh.
on one side I have been talking to chiropractors, orthopedics, physiotherapists, and
Yeah.
recently I injured the other side of my calf, and my
Yeah.
physiotherapist also was concerned and said, need to have an image. So she was very pushy about that, and then I got very pushy about that. So I said, this time I'm gonna go for the imaging. But
Okay.
I
Yeah.
believe I should have
Let's
done
do
it before. But
let's do a CAT scan. I'm gonna order an urgent one to be done at Mount Sinai. Have you ever had a CT done before?
in that area, no.
No. Okay. Yeah. So we're gonna do that just because it looks like there's something going on with the bone. Have you broken your tibia or fibula before? Fibula?
No, no, I didn't break any bone, but there has been all this situation at insertion point.
So
So,
this isn't in that. This isn't in that area. This is in a slightly different area.
so
Um,
there's no like soft tissue connecting to it.
Here, let me walk you through it. So, you can't really tell. They see this, like where the swelling is on the upper calf near your knee, and it's quite large. It's like 8 centimeters, right? So it's quite big, and they don't know what it is. Like, is it blood? It's probably not an infection or you'd be, um, but it does seem to be continuous with something going on in your bone. So it seems to be touching the bone. Why that is, we have no idea. Until we do a CAT scan, we really can't. So I'm going to order you an urgent CAT